Hi, everyone. I am here to talk about integrative and lifestyle medicine in physical therapy. And today we are lucky enough to be hearing from sleep expert and physical therapist, Dr. Katie Siengsukon. And I'd like to share a little bit of information about her before we launch into this interview. So welcome.
Thank you. Thanks for having me.
Yeah, I'm glad you're here. Um, Katie is an associate professor and director of research for the Department of PT, Rehab Science, and Athletic Training. And quite important for us as PT, she's the director of the Sleep Health and Wellness SleepWell Lab at the University of Kansas Medical Center. Her research interests involve in studying how sleep impacts health related outcomes and recovery, particularly in individuals with neurologic injury or disease, as well as behavioral interventions, exercise, CBT, etc., to improve sleep. Her research has been supported by the National Institutes of Health, the National Multiple Sclerosis Society, and the American Heart Association. Dr. Siengsukon received her MPT from Rockhurst University in 2002, a PhD in Rehab Science from the University of Kansas Medical Center in 2008. Welcome.
Thank
Welcome,
you.
Katie.
Thank you for the
Yeah.
introduction.
Yeah. First of all, I've wanted to do this for years, and now I get to do it because we're kind of in person. Is to like applaud the fact that you head up a sleep lab as a physical therapist. When I first heard of you and your work, I was doing this. I was like, yes. I had to take a moment because that made me so happy. Starting out I went to PT school in '96, and starting out in PT school when we had no classes in health and wellness, nothing in health promotion. I had to go over into the School of public health to get anything on these topics. So I'm just in awe. Thank you for the work that you're doing and for your focus.
Well, thank you. I
Yeah.
appreciate that.
And I'm sure that you've got no pushback along the way whatsoever.
We could talk about that journey the entire time.
Well, I guess the easiest way to start off is what made you even choose PT to begin with?
hmm Um, so how I chose PT way back when, it seems like a really long time ago, well, because now it is kind of a long time ago. I was actually in high school when I came over as sophomore, junior year in high school, and we had a career fair as part of my high school. And I had never heard of physical therapy until a physical therapist came to our career day. And she obviously loved her career, loved her job, loved what she did. She was a pediatric physical therapist, and she just exuded this like love of what she did. And I was so captivated by somebody being so enthralled with it. And I knew I wanted to do something in the medical field. I loved anatomy. I loved learning about how the body worked. I just wasn't quite sure what career path I would take. And like I said, I didn't even know if physical therapy was an option. I didn't know any physical therapist. No one in my family was a physical therapist. And so it really was a great opportunity to learn about this whole entire career that I never even knew existed. But once I learned about what it was and what it involved, I was set. I went to undergrad knowing that I wanted to go into physical therapy. I actually chose the university I did because they had a program where you could start undergrad and then also transition into the master's levels program. And so I was once I made up my mind, that was the path that I ended up taking.
Wow, that's fantastic. The beginning of your story was actually identical to mine.
Huh.
I haven't heard somebody with the same story. Yeah. Except it was a classmate because we were presenting on careers and a classmate presented on PT. Same thing.
Uh-huh.
Didn't know that existed.
Yeah.
Sounds like fun. It sounds like an active career. I thought I was going to go to law school.
Huh. Yeah, very different from law school for sure.
Yeah, yeah, yeah. And I went to a law symposium and I was like, sitting all day, every day, I can't do it. So, wow. Well, that makes me want to note when my high schoolers, I have two teenagers in high school, when is their career day?
Right, right. And I know I have a middle schooler, and same thing. They have a career day, and I think, wow, I need to make sure that I'm there so that I
Yeah,
can share about physical therapy and what it is, because I think we need to be promoting ourselves too, very, very early and very young. And I think those career fairs definitely have some value.
they sure do. They really do. I wish we had more exposure to that and that our kids had more exposure to that. Um, well, as a PT, what's one of the most valuable things that you think? I mean, it can be it's what you enjoy the most or what you think is the most valuable piece of what you do, but what would that be?
Wow. So what I value most about physical therapy, I think I value just the variety of clients that we can work with. And I don't think I really had even appreciated that when I started the PT program. But I think just the breadth of people and the impact that we can have on their lives. I think also that opportunity that we have to really connect with our clients, and not saying that other healthcare providers don't have that opportunity, but I think because we oftentimes work with our clients over multiple sessions, we really develop this bond and we really get to know them, which then I think also allows us to really address and help guide them in their journey of health, in a way that a lot of other healthcare providers don't have the opportunity to do so.
Yeah, I feel the same. I think we have a unique opportunity because we get to spend so much time with them. I think this the next question I'm thinking about in my head because I'm super curious as a PT who's I practice yoga and Pilates and mindful movement and then getting into lifestyle medicine and all that journey. I'm intrigued to know what made you choose sleep
Hmm.
in physical therapy. How did that journey happen? How did that transition happen?
Um, so after I graduated from entry-level physical therapy program, so that was in 2002, I practiced full time as a clinician in an outpatient practice. And so it was a very general outpatient practice. We saw patients with all sorts of different diagnoses, from orthopedic to neurologic. Um, and what resonated with me was, and what I felt ill equipped to help my clients navigate, was their sleep challenges. I felt like a lot of patients were reporting that they were having difficulty sleeping, because of X, Y, and Z. It could be because of the injury that they've come to see me, or the condition that they have, or the onset of a neurologic condition, whatever it was, across the board. So many of them were reporting having sleep challenges. And that was something that I had not learned anything about in physical therapy school. And, I would talk to them about positioning, and that was about the only thing I felt comfortable talking to them about. But I think that's really what piqued my interest is, gosh, this is an important factor for most of my clients, if not all of them. And it's something that I don't know much about. And so that's really what piqued my interest. But then when I decided to go back to do my PhD, and I knew I wanted to stay in Kansas City. I have family in town, and just for various reasons, wanted to stay in the area. And Laura Boyd was on faculty at KU Medical Center. And so she was studying factors that influence motor skill learning in people who had had a stroke. So things like amount of practice, type of practice, timing of practice, those sorts of things where we think about motor learning. And so this was now 2004, and that was when several people were starting to study the impact of sleep on learning, both learning declarative information, but also learning motor skills. But nobody had looked at, well, does sleep impact learning of motor skill in people who've had a neurologic injury? So long story short, that's what I ended up doing my dissertation project on, which, obviously it was a very narrow focus as far as the relevance of sleep, because it was specific to how is sleep impacting motor learning. But it taught me how to be a good researcher and the research method and all that. But it also really opened my eyes to the importance of sleep for basically every function of our body. Yes, it's important for learning new skills, it's important for memory consolidation, but it's also important for immune function and cardiovascular disease and all of these other health benefits that, again, just really opened my eyes to that breadth of the importance of sleep. And I thought, gosh, why is this not something that physical therapists are learning about? And so that really then again, I think it jump-started both my research career as far as sleep, but then it also jump-started my interest in getting this information out to physical therapists, just as far as like our role in helping to identify sleep issues, refer as needed, but also help to guide our clients in sleep health promotion techniques, within our scope of practice. And so that's really my passion, is just getting that information out to physical therapists and be like, yes, this is within our scope of practice. This is within our wheelhouse. And I think maybe most importantly is that this impacts our patients' recovery. It impacts their well-being. It impacts their health. It could prevent or delay chronic conditions. I mean, so it's not just a like, yeah, we should do it. It's that we really need to be doing it, and it's
Must.
what's best for our patients.
Yeah, it's a must. Okay, so I'm going to take just a moment to plug Katie's chapter in the book, which is an absolutely lovely chapter on sleep and the relaxation that must occur with it in order for it to happen. I think I have a curious question because I remember when I first started to talk to patients early on about integrative techniques. It could have been mindfulness or a yoga based or Pilates based movement. I'm thinking back, to 2 decades ago of some of the challenges that were there.
Hmm.
Some people might call it pushback. Some people might say, "Oh, what does sleep have to do with my back pain? What are some of the ways that you've encountered those challenges, and how have you overcome those?"
Hmm. Um, so I mean, I think that there definitely has been pushback. And I think anytime you're talking about, expanding practice or expanding thoughts on scope of practice, I mean, I think there's going to be a little bit of, healthy dialogue, pushback, if you will. But I definitely did struggle in that regard. And I think too, it's just, a new faculty, a new researcher, being fairly junior, I think that came with it too, is like, well, you don't have a ton of experience, and you don't come with this, really robust sleep background, as far as training and sleep, which I have gone on to become board certified in behavioral sleep medicine. So I hope that kind of squelches, that little bit of that pushback. But I think I had to look at this as like the long game, right? Like I could be trying to get out in front of people at CSM, or just having conversations with various people on podcasts, and talking about the importance of sleep. But I think being able to tie it, and this is really, I had this like aha moment. I had published that paper, the perspective paper in 2017, about the PT's role in sleep health. But what I think a lot of people don't know is that paper actually got rejected when I initially
Wow.
submitted it. And I can't remember if it was like 2014, 2015. But yeah, it was one of those where I had revised it and I revised it and I revised it multiple times, and it kept getting asked for more and more revisions. But then ultimately it got rejected, and I mean, devastated, to say the
Hmm.
least. And so I tabled it for a while, kind of licked my wounds for a little bit. Um, but I had to take a step back and think about how to best frame it. And and it was actually, it's better now. And I can say that now, in hindsight, of course. But I think the paper is better now, and the recommendations I was able to write into that paper, I think are better, because I framed it in the context of health and well-being. And so I think that's where PTs are kind of like, of course, that makes sense. Like, rather than just, the importance of sleep, if we can frame it in the context of sleep as one of the main pillars of health and wellness, along with exercise and nutrition and stress management, and all those good things. And I think a lot more people are kind of like, yeah, that does make a lot of sense on why we need to consider sleep as well as these other pillars of health and well-being. Um, I think too, I also needed our profession to kind of move to the point where they were more open to prevention and health promotion and wellness. I think it just needed to be like enough critical mass of people that are kind of like, yes, our profession really does need to focus in those areas. And then, then of course, sleep is an important piece of health and well-being as well as prevention. So I think it was just a matter of, just kind of biding my time a little bit, making sure I framed it in an appropriate way that made sense. But I think now that people get it, and two, I think our profession had to move to the point where we were focusing on the holistic person. We kind of had to shift from this really medicalized model to really thinking about more psychologically informed patient care, which again, I think people are buying into that and recognizing the importance of sleep as well. So again, I think it was just a matter of a little bit of movement as far as our profession. And I think what's also been helpful is kind of finding other physical therapists who really get it as well. And I think again, kind of creating a coalition of people who are interested in prevention and health promotion and wellness. And that's been incredibly helpful, to kind of find that tribe of people, because then it's more than just my voice continuing to be like, yeah, sleep is important, sleep is important. And now we have kind of a whole group of people that are saying like, sleep is important as well as these other health behaviors, because that's important for health and well-being and ultimately recovery of our patients.
Yeah, it makes me wonder if in our particular text here, because you have a tribe of 40 people, of 40 physical therapists who are experts in this area writing on it. I wonder how many times sleep is mentioned through all of the chapters. Now I'm curious because I know every chapter probably mentions it at least once, if not a dozen times, and then we have a whole chapter dedicated to it. So I'm wondering if in direct clinical care, because I know this question comes up to me all the time, teaching other PTs, OTs, and mental health providers how to use integrative and lifestyle medicine in their practice, I get this common question. Well, what if your patient or your client is then pushing back?
Mm,
Then how do we approach that? So
mm,
I'm going to relay that question to you because I know you've probably gotten that quite a bit. I mean, you run the sleep lab now. I'm sure
yeah.
you have all kinds of stories.
Yeah, yeah. I mean, the good thing is that when people come to us, to our lab, it's because they know they have sleep issues and they want to do something about it. So
Yeah,
I am
they've gotten
frequently
past
working,
that.
absolutely. I mean, I'm frequently working with people who are like all in, are more likely have had a sleep issue for 5 years, 10 years, however many
Mm,
years, and are desperate to sleep better. I think another benefit of the sleep piece, is that everyone has likely had an experience where they haven't slept well, and they know that even one night of poor sleep, you maybe don't feel great the next day. Like your brain's not working as well, or you just feel really tired. Maybe you're like, oh, I'm gonna have another cup of coffee. Whereas I wonder with, not wanting to eat, well-balanced diet, not wanting to exercise, I don't know that you see that immediate negative consequence quite as much as you do with not sleeping well. And on the flip side, having people do experiments where they are like, okay, let's do a week where you're trying this to enhance your sleep. Oftentimes we can get people sleeping better fairly quickly. So again, they see that positive benefit again relatively quickly, where I don't know that there's always that such an immediate an immediate obvious benefit for other health or lifestyle behaviors. So getting people to buy in as far as wanting to address their sleep, again, it's not oftentimes very difficult. And if they do, they're often willing to like be like, sure, I'll try this for a week, and then they're like, wow, my sleep is so much better. Why didn't I do this, 5 years ago?
yeah, that's a really good point. So that's a good way to sell the benefits of sleep, the obvious benefits of sleep. And I think another important point that you brought up made me remember when we're talking about, let's just say, smoking cessation or avoiding, environmental pollutants that would impact systemic health, not just musculoskeletal health, is getting the person to share with you why they think improved sleep would help them,
Mm-hmm.
or getting to share, getting them to share a story of how when it could be sleep, it could be another topic, but since we're talking about sleep, if they didn't sleep well, how did they feel, how does it
Mm-hmm.
personally impact them, and
Mm-hmm.
then they're their own motivator, to create that change. So
Absolutely.
yeah, it's a powerful take home
Absolutely.
message for. I know there's a PT listening who is trying to talk about sleep with their patients, and they're getting that. Well, why is that important? I
Right.
think that if you ask the patient or the individual, the person, why it's important to them, then they'll come up
Hmm.
with their own
Right, right.
answers. Yeah.
Well, and I
Opinion.
did because we know the benefits of sleep. We think like, yes, you just tell people to go do these things and they're going to do it. And so I ended up doing training in health coaching. And so I went and did my certification in health coaching, and I found that so incredibly helpful because I think to your point of assessing how important is this behavior change to the individual, how motivated are they? I mean, I think that really impacts how you approach it with that particular person, the words you use, the strategies that you use, the motivational techniques that you use. I mean, to me, that is that because that was not something, again, I learned in my physical therapy program, although I think more and more programs nowadays are including more training on coaching and motivational interviewing and those various communication techniques. But that was hugely helpful for me as far as I think helping clients change behavior as well.
Yeah, that's another important point, because we know that talking about sleep is within our scope. And I so appreciated when they finally did publish your paper. That I was super excited about that, and I do cite your work frequently when I'm teaching. So thank you again for that. But what I was going to mention there is, people often ask about that scope. And yes,
Hmm.
it's in our professional scope. But then I often invite therapists to take it a step further and say, okay, if it's in our professional scope, yes. Is it in your personal scope? Maybe not. And then
Hmm.
that's when, the flag goes up and you go, okay, well, let me vet what's out there in terms of continuing education. Because if, I was born as a PT in 1998, right?
Hmm.
So as I think anything prior to that, we got nothing.
Right, right.
We effectively got nothing on that, and now, thank goodness, there are programs increasingly that are including these topics and including the text, which is wonderful.
Hmm.
So I think we have to encourage new PTs to ask that question. They know it's in their professional scope, but if it's not in your personal scope, then seek out that continuing education that you feel like will make you well-rounded.
Right,
Yeah,
absolutely.
yeah. Um, so sleep is, for those listening and don't know, sleep is one of the solid pillars, the solid six pillars of lifestyle medicine. Um, so it is part of that integrative lifestyle approach that kind of naturally pulled you in. But did you pick kind of an integrative lifestyle approach first, or do you think that sleep called out to you first and then that became integrative and lifestyle medicine?
Hmm. For sure, sleep called out to me first.
Okay.
I mean, I definitely saw that as a new clinician and recognizing that I didn't have sufficient background or training or even just, what do I do and to help people sleep better? Who do I refer them to even? And that's so that clinical piece I knew was missing as far as my training. But then absolutely, I think how I've helped physical therapists see the value in sleep is really, like you said, then tying it to that lifestyle medicine piece, tying it to that holistic person. And if we're going to help that entire person, you can't not talk about sleep along with those other pillars of optimal health. So I definitely was first, I think teased by sleep, but certainly see how it now fits in with a more, lifestyle medicine approach. And I think though too, the more I've learned about how sleep impacts nutrition, or how our meal regularity impacts our sleep, how our stress impacts our sleep, or sleep impacts stress. So all of those components are also so interrelated as well. And so it'd be really remiss if I was just sitting here talking about sleep, but not recognizing how it fits within the context of all of those other pillars, and that relationship between sleep and all those pillars as well.
Yeah, absolutely. It's a very synergistic, interdependent relationship.
Hmm.
So you have to be, with the research you're doing and running the sleep lab, you've got to be crazy busy. So just a little bit,
Just a tad.
just a tad. So I'm wondering, well, from one, female clinician to another, how do you do all of that? But I'm also wondering what your typical day looks like. What are the patients that you see that come in? What are the most typical problems that they have, and how often and what do your referrals look like? So kind of take us through a day in the life, if you
Hmm.
will.
Sure. So I am full-time academia. So I teach, I do research, I do service as part of my job. I also have four kids between the ages of 8 and 14. So they also keep me very busy as well. It's funny that you asked because I was just part of a talk at CSM about your research path. And so it gave me a chance to kind of reflect on my research path and then give a 5 to 10 minute little piece about how I got to where I am and maybe some lessons learned. And really some of my main lessons learned is I'm intentional with my time, and so as I think COVID has kind of messed up this work-life balance a little bit, or the barriers or the boundaries between work and life, because we now can work everywhere and anywhere at all
Mm-hmm.
times. So that's been a little more muddy. But I am very intentional. Like if I'm at home with my kids and we're doing something, then I'm with them. And when I'm at work, I am in work. Not to say that I don't have to work at home on the evenings and weekends, which I do. But again, I'm very intentional with that. With I have this particular project, it's going to take me 2 hours to do, and I carve out that time, and then I'm done. Um, but I think though on the flip side, having kids, having family in town, I think it also gives me kind of a sense of purpose as far as I'm more than a clinician, I'm more than a researcher, I'm more than an educator. As all of us are, we're very nuanced people with various roles, and I think that helps give me a little bit more balance in my life. But my typical day, gosh, I'm not a triathlete, so I apologize if I offend anybody, but I kind of see my day as kind of being like, I have three different events. I have my morning event where I'm getting the kids up and I'm getting them out the door, and then I come into work, and then I have my work event, and then I have my evening is the way I cap it off, and we're running around to various kids' activities and sometimes putting them to bed and doing a little bit more work. But my typical day at work, what I love about what I do is the variety. I get to do research, which I find so gratifying. I love to write grants. I love to write manuscripts. I see the value in, getting the funding to do the work, but then also publishing the work to disseminate it. I love that I get to teach in our physical therapy program. We also have a PhD program, so I mentor PhD students as well. I love that I get to work on various service opportunities. But as far as the people that we see, the clients that I work with as far as sleep challenges, it's all related to our research projects. And so it really kind of varies on whatever research project we have going on. So like right now we have a big clinical trial that's funded by NIH, where we're doing cognitive behavioral therapy for insomnia in older adults to see if it enhances cognitive function and reduces beta amyloid accumulation. So I am supervising. I have an interventionist who provides the CBT-I, but I provide oversight on that intervention. And then we're in the works because I've realized, like, yes, CBT-I is effective to treat insomnia, but man, we're missing a whole lot of people that maybe don't have a diagnosed sleep disorder, but likely have poor sleep health. So I'm very interested in kind of expanding those interventions beyond just treating insomnia, but really to more of a sleep health enhancement intervention. So I'm hopeful that we'll get some funding for that, and we'll develop that program, because I think that will also be really relevant for physical therapists, because that is one pushback that I get is, great, Katie, that you do CBT-I, but I don't want to go out and be trained in CBT-I. And I don't suggest all PTs do that, but I think we certainly could be helping to promote enhanced sleep health. And so I think if we had a more structured program on how to do that, I would hope that would be more easily integrated into PT practice then.
Yeah, I think that's a really important distinction in your research work, and I'm really glad you're making that leap from people with diagnosed sleep disorders who we would naturally know need that intervention to the millions of us out there in the world who have disordered sleep without a diagnosis. And then here we are with a range of, I'm in pelvic health, I also see orthopedics. So it could be pelvic organ prolapse, where they're getting up 3 or 4 times a night to go to the bathroom, etc. These people deserve, sleep hygiene and health and intervention as well. So,
Right.
what would you say then to the therapists out there who are, since that you're looking in that direction for research, what would be some of the red flags that you would identify of not having a sleep diagnosis, but just having struggling with sleep or having just
Mm.
disordered sleep in general? What are some of
Yeah.
the things that therapists can initially look for? Which I think also begs to say it's in your book chapter, but
Right.
I guess that would be, what are some of the most important things out of that book chapter? And I think that would be one of them, perhaps.
Hmm. Right, right. And because I think you have an excellent point, and I think I would love for people to start to think about how everyone has a sleep health, right? Like thinking of sleep health on a continuum where you can have like really poor sleep health, but you can also have really good sleep health. And everybody falls somewhere on that continuum, regardless of not if you have a sleep disorder. Because in sleep medicine, we typically think about, oh, insomnia, you get treated by this. With sleep apnea, you get treated by this. With restless leg syndrome, you get treated by this. So I want to move beyond just this idea of you have to have a sleep disorder, but we all have this continuum of sleep health. And how can we optimize sleep health for every person? And so I think sleep health is a newer concept. Again, because we've been so focused on sleep disorders that there's a scale that so Dan Bicey, who is the one who created the Pittsburgh Sleep Quality Index, which a lot of people are probably familiar with, he has also created a sleep health scale called the Are You Sated scale. And so that's a questionnaire that looks at, so Are You Sated stands for different words. So like regularity, satisfaction, alertness, timing, efficiency, and duration are the components of sleep health. And so there's a question for each of those items on this questionnaire. The issue with it is that there's only been one study that has validated that questionnaire. And so I think with any new questionnaire development, there's always, kind of a development period, right? Where they put it out there, but then there have to be validation and reliability studies until people are like, yes, this is a great questionnaire to use. So it's really kind of at its infancy at this point. There's also been some interest in looking at sleep health using kind of a combination of self-report measures as well as actigraphy. Because again, you can measure obviously duration with actigraphy, or you can measure alertness using the Upward Sleepiness Scale. So there's been some efforts again to kind of build what we call the sleep health composite using these different assessment tools. And there's been a couple studies that have been published using this sleep health composite score. So that I think that's the challenge, is like, how do we define sleep health, and then really how do we assess it? And I think that's still kind of being grappled with, within the clinical and research world about how to best do that. And some people will use like the Pittsburgh Sleep Quality Index as a way to look at sleep quality. And that certainly is one important piece of sleep health. But that's obviously a very well used tool. But I guess I also don't want to discount the importance of screening for common sleep disorders, because we certainly know that there's a large number of people that have undiagnosed sleep apnea, have undiagnosed periodic movements of sleep, and they are having what they're reporting as poor sleep or not restful sleep, but yet they're not getting assessed for those sleep disorders. And so I think we certainly still, even with our emphasis being on sleep health, I think we still need to be mindful of those sleep disorders and helping to screen for those sleep disorders, because we would then refer those people for the appropriate treatment that they need, because just promoting sleep health is obviously not going to keep somebody's airway from collapsing while they're sleeping if they have sleep apnea, for example.
Right. And that's one thing that you've said really resonated with me, because I think it's the struggle that our healthcare system lives in daily, which is we can identify disorders, these diagnoses, but integrative medicine, its history has been really rooted and seated in identifying precursors to disease and disorder. And I
Hmm.
think that's what we're talking about is there's the screening inventories, which would identify problems that require a referral, but this new inventory would help us identify precursors and just improve their overall sleep hygiene and wellness in a way that we really haven't had available. And like in other areas of medicine, they're missing too. What if we had ways to, I think integrative medicine does answer that in a lot of ways, and so does lifestyle medicine, is to identify root cause that could lead to heart disease, root causes that lead to metabolic syndrome or certain types of cancer that are preventable, that type of thing.
Hmm.
So that when you said that, I was like, oh yes, that's the heartbeat of the integrative approach is to identify precursors to
Hmm.
disorder and disease.
Hmm. Yeah, absolutely. And I think we know that sleep and poor sleep is a health risk factor for lots of chronic conditions, um, and or could be an early indicator of possible disorders. And so, I mean, I think that's just another way to be thinking about it of like, I'm really doing a disservice to my clients if I'm not doing this assessment because we could be catching these things earlier on. Um,
Yeah, yeah, absolutely. And the way that I'm in the clinic several days a week um, with my practice, and will talk to people about sleep is usually the first thing that I ask about in the lifestyle inventory.
oh, wow, that's awesome.
Yeah, well, and I explain it to them this way. I say, if you're not sleeping well, it doesn't matter how good I am as a therapist.
Yeah.
It just doesn't. Anything that I prescribe for you is going to fall absolutely flat. So let's get this sleep thing worked out first, and then we'll go from there.
Mhm.
Um, that's a good segue to a question about the barriers that I think to integrating sleep health, because as a practicing clinician, I know what most people know what they're getting by the time they see me, because that's what I do. They're coming in to
Yeah.
see me for that particular reason. But I know that PTs who are practicing in large healthcare systems, in rural areas, in small outpatient clinics that see everything, what do you think some of the, or you hear or know or understand, what are the barriers to integrating sleep health into those types of practices for PTs?
Yeah. So we actually just did a study on this because I would love to develop a toolkit for physical therapists. But I needed to first take a step back and see like, well, what, because I think I have in my head what would go in this toolkit, but I wanted to make sure I was doing due diligence and understanding current practice to see what are the barriers and facilitators, and then, what would people want to see in this toolkit. And so it actually just got accepted for publication like last week. So that should
Oh,
be out soon.
wonderful.
But
Congratulations.
thank you. But the gist of, and it's probably not a huge surprise because there's been some studies that have looked at the barriers of integrating health promotion into PT practice. And so in some ways it kind of mirrors some of those themes. So probably not a huge surprise that resources is a big one. And so kind of and knowledge, like having that knowledge to screen for sleep issues, to promote sleep health, and then not having those resources again to build your knowledge and have kind of those readily available resources. I was surprised. I had thought that time would be a barrier, but that was not something that percolated to the top, which is great. But I think being mindful of how we would integrate sleep, I think over time, over sessions is perfectly reasonable to do. It doesn't have to be one sit down conversation. It can certainly be integrated over multiple sessions if needed. So that was, I think, good to validate that those barriers really boil down to resources and knowledge, which we can certainly provide resources, and we can certainly provide education opportunities for physical therapists to learn more about sleep. What was fascinating, though, that I hadn't expected is PT's perceived patients having low motivation and low self-efficacy as far as changing their sleep behavior. So I thought, so again, I think the important distinction, though, is that it's not the patient's low motivation or low self-efficacy. It's their
It's their
perception that the
perception.
patient has it, which, obviously we're not assessing patients either. So, but I think that really, that was interesting, but I think it also boils down to guiding physical therapists, and I'll say other healthcare providers as well, to assess for motivation, assess for self-efficacy, making sure we're having those conversations, but then taking on a more of a coaching approach of if somebody maybe does have low motivation, or maybe doesn't have self-efficacy surrounding changing their sleep behavior in this case. How do we best, again, coach them, motivate, the words we use, or perhaps we don't touch sleep to begin with. Perhaps they're more open to talking about changing their diet or changing their physical activity level. Like maybe you start there instead, if that's where they identify the importance or the motivation, and then build their self-efficacy with changing that behavior, and then maybe revisit sleep later on. So anyway, I think again, there's that opportunity of like let's coach PTs to be coaches to help change our clients' behaviors, regardless of what health domain we're talking about.
Well, I'm so glad that you're doing that research. And again, congratulations on that acceptance. I'll look forward to seeing that paper come out. That's certainly going to guide what happens, in our profession moving forward. Um, and that I think is a good segue into looking at opportunities for the future. Like, what do you see as opportunities for integrating sleep health into PT practice?
Yeah, I mean, I think the big opportunity is just getting more education into entry-level programs, which again, I think all of this is changing. I mean, I think we're really hitting kind of this wave of people have been like, yes, sleep's important, health promotion's important. Um, and so I see a movement for sure for more PT programs, including sleep in their health promotion and wellness classes. Of course, we have a lot of practicing clinicians out there that would benefit, I think, from opportunities to have continuing education, which again, there's a lot of opportunities out there. But I think we're seeing that movement of less pushback from the PTs themselves, and more of them being like, yes, I want to have this information, I want to have this knowledge, I want to know how to do this because I see the benefit in doing this with our clients. And so I think a big opportunity is to be able to provide those resources and provide those education opportunities. If we could come up with kind of an easy to disseminate sleep health promotion intervention that PTs could be like, that's the 3 module or 4 module approach, and I could do all those modules in one visit, or I could break up those modules over multiple visits, but that way they would be like, so that's really the key pieces that I should be focusing on. I think any way that we can, make it more manageable, more straightforward, more structured, knowing full well that there'll have to be some tailoring considering the individual client. But I think the more we can help guide the PTs is like, here's what's best practice, here's what you should be doing. I think that can be very helpful. Again, knowing full well PTs have busy schedules, we've got lots of clients, we've got lots to do. How can we make this so it's feasible and manageable and ultimately doable in clinical practice?
Yeah, because there's 5 more pillars and integrative, techniques, and there are so many different integrative techniques that can resonate with different patients, whether it's Tai Chi or yoga or whatever it is that, really speaks to a person. Um, so what would you say? Let's say we have someone, listening or in front of us that has, an immediate sleep issue. What's like the baseline thing that you start out with, with sharing with them? What's the most common, issue that you think PT
Mhm.
should be addressing straight out of the gate?
Yeah. So this is a somebody who actually has a sleep issue.
Yeah, they come in and this is pretty much everybody that walks through the door that I see. They sit
Hmm.
down. The sleep question is the first one on their lifestyle inventory. They
Hmm.
fill it out in the intake form, and then I ask them about it
Hmm.
because inevitably they'll say, 6 hours, whatnot, and I want to know, are they waking up in the middle of the night? Can they not get to sleep initially? What is
Hmm.
the actual problem with sleep?
Hmm.
So I would say nearly everyone that walks in the door is going to have a problem with sleep. Some of
Hmm.
it's just because they have a 6 week old.
Right, right.
But barring that it's a 6 week old, let's just say that their kids are not the reason they're not sleeping through the night.
Hmm.
What are some of the low hanging fruit things that you think are helpful,
Yeah.
to
Okay.
as a first step?
Right, right. And I think, just like you're doing, first of all, is kind of trying to understand what's going on, right? Like, is it a sleep duration issue? Is it a sleep quality issue? Are they waking up to go to the bathroom frequently? Is it a stress issue? So there's a little bit of kind of that, what I would call like a case conceptualization, right? To kind of figure out the what's contributing to that sleep challenge. And again, also thinking about, well, could this actually be a sleep disorder? So I do need to refer them. Does it sound like sleep apnea? Refer them for further assessment and possibly treatment for that, assuming it's not a sleep disorder. I think of sleep health as kind of having four what I call buckets. So I think about entraining circadian rhythm, and I think about increasing sleep drive. I think about reducing pre-sleep arousal, and I think about then everything else I call sleep hygiene. So like behaviors, environment that facilitates sleep. So like with entraining circadian rhythm, I'm interested in how variable is their sleep schedule. So I focus on having a regular wake up time, exposure to light in the morning, exposure to light during the day, lack of light ideally while you're trying to sleep, because we want, of course, the brain knows that when it's dark, that means I should be producing melatonin. So those are some kind of low-hanging fruits to increase entrainment of circadian rhythm. For sleep drive, exercise is great for lots of reasons. We also know that exercise and physical activity increases sleep drive, as does just being cognitively active. The longer you're awake, the higher your sleep drive is too. So things like trying to avoid naps if possible. Again, that is very dependent on the patient. But those are some ways to increase sleep drive, both exercise, cognitive function, just being active. Reducing pre-sleep arousal is something I spend a lot of time with a lot of clients. So those are things like having a relaxing bedtime routine, so the brain knows that what comes next is the bed and sleep. We focus a lot on relaxation techniques. I find that a lot of people are just, go, go, go all day. And then it's like, oh, it's getting close to bedtime. I better do my relaxation technique. And well, it's really not sufficient to do it right then, right before bed. So I usually encourage people to practice relaxation throughout the day. We practice a lot of mindfulness, so that they note kind of that stress response that they're having, and hopefully choose to do a relaxation technique at that time. And then the other bucket, again, is kind of the sleep hygiene, which typically in and of themselves is not going to be sufficient to dramatically change your sleep health, but things like, avoiding caffeine in the afternoons and the evenings, avoiding nicotine because that's a stimulant, being mindful of your water, your fluid consumption so that you're not having too much fluid before bedtime, thinking about your sleep environment, comfortable bed, quiet, those sorts of things. So those are kind of the four buckets that I'm thinking of as I'm talking to a client and hearing their story and their challenges with sleeping. I'm thinking about each one of those and what are possibly the factors that are contributing to those different areas of sleep health.
Thank you. I love the way that you break those down. That's wonderful. I hope that everybody has picked up a copy of the book and that you're particularly reading the sleep chapter, because I totally believe it's right up there with behavioral change for me.
Oh
If
yeah.
they aren't able to make that shift and change, it doesn't matter how good of a therapist I am. And I think sleep is the same. If they can't do that, it doesn't matter what I can do for them as a therapist. So I hope that's something that those of you guys listening out there have picked up a couple of clinical pearls and some nuggets of wisdom about sleep, and that that leads us all to get a really good night's rest tonight.
Amen to that.
Katie, I want to thank you so much for sharing this time with us. I hope that therapists, we're no longer questioning whether sleep is important. It is how we're going to discuss it with our patients, and how we're going to guide them in a really compassionate and empathic way towards creating the change they need for good sleep.
Well, thank you for having me. This was great. I really appreciate it.
Yeah. Is there an easy way that they can find you, online, look you up, etc.?
Yeah, I'm fairly active on Twitter. I'm at Katie Sleep PT. That's one way to reach me. You're also email. I'm on my email quite a bit. That's C for Catherine, and then Siengsukon last name at kumc.edu. I like to talk about sleep, and so feel free to reach out, and I'd love to chat some more if people have questions.
Thank you so much.
Thank you.